Okay, so just a very quick introduction. As I said, we've already introduced ourselves, and I'll hand over to Thomas initially to tell you a little bit about him.
Hi guys, thanks for coming. So I'm Tom, I'm a cosmetic dentist based in Essex, and I fell into cosmetic dentistry by accident really. I was an NHS dentist for about 8 years, actually doing general dentistry, and I just started to try my hand at a little bit of cosmetic stuff. Bit of tooth straightening with the inland aligner, bit of composite bonding, veneers, that kind of thing. I got to the point where myself and a friend of mine said, we should probably think about the future, let's get some quiet practice. So we went for an NHS practice and we couldn't afford it, and we got gazumped. And then we went for another one, we got gazumped again. Then we went for another one, we got gazumped again. We just couldn't afford an NHS practice. So we had no choice but to buy a private practice because the fees, the cost was considerably less. And the next thing you know, we were in this private cosmetic dentistry practice, and we really didn't know a lot about cosmetic dentistry. So we had to really up our game. So we went on loads of courses, and I started to realise that the dentistry that I wanted to achieve required more time. And so I increased all my patient time by 25% across the board. After about 18 months of being a private dentist, I said I can't work at the pace that I'm used to working at NHS, I need to slow things down to achieve the results I wanted. So I increased all my patient time 25, 30%, a 2-hour appointment became a 2.5-hour appointment, a 1-hour appointment became an 1.5-hour appointment. As I increased my time, I started to get better at dentistry, I started to improve, I started to take photographs, I started to get noticed on social media, but it wasn't sustainable. And my accountant actually said to me, sat me down and said, Tom, what you're doing is not sustainable as a business. The time you're putting in to get the results you're getting is beautiful, but it's not working, you're losing money, you've got to change something. And so I kind of got to this point where I realised that something had to change. I wanted to be a good cosmetic dentist, I wanted to achieve beautiful results, but I could not spend the time I was spending putting in to that. And it just so happened that kind of time when I was questioning where I was going to go, Midi and I got together and we started talking this out, and we both had exactly the same understanding of where we were at and where we needed to be, and that's where Smilefast came about from. It was born out of frustration of not being able to achieve beautiful results in the time frame that was required. The only way to do it was to charge the patients more, and then the patients couldn't afford it. So it was a lose-lose situation, and we needed to change it, and that's where we came up with Smilefast.
Yeah, my story is not too dissimilar. I started in general practice, working predominantly NHS. Over time, I realised that what people want is often something cosmetic that makes their teeth look better. So I developed initially starting with some minor orthodontics, and then from there I started on this journey. I got to the point where I was fortunate enough to start working in a really good private practice, and then I thought next career step is set up my own practice. So in the normal or not so normal way, I decided to start a squat practice with 0 patients. Probably the single most stressful thing I've done in my life, but thankfully it's going well. The single thing that I realized that my patients wanted in my new practice was after I'd aligned the teeth, they wanted their teeth to look better. So invariably I was doing a lot of composite bonding, but these cases were taking me on average between 4 to 6 hours. Now, as Tom says, that isn't sustainable. The results were brilliant, but it's actually physically quite tiresome and it's back-breaking work. And I'm sure maybe like most of you, you get to a point halfway through, you look at it and you think, if this doesn't look right after 3 hours, I've just wasted my whole afternoon. But it always turns out good in the end. But it's that stress in those cases that made me think, there's got to be another way. And Tom and I were sharing a bottle of rosé, very romantic, on a dental ski trip. And we thought, we've got a solution. So that's what we're going to present now. I'm just going to play this video very, very quickly because apparently...
Hi, My name is
Tom. Very good in real life, so we made a video.
We are two normal guys who share a lot of common interests, like sports, skiing, and oh yeah, making people smile. We might have forgotten to mention that we are dentists too.
Our journey started on a dental ski trip to the picturesque French resort of Morzine, where we bonded over a bottle of rosé and debating a frustrating yet common dental problem. How can we improve the quality and consistency of cosmetic smile makeovers and reduce our stress in these cases? The problem is that dentistry is hard for all of us, and cosmetic smile makeovers are especially challenging. We often struggle to plan the right treatment for our patients, where to start, and how to achieve the best aesthetic results, especially with the overwhelming number of options now available. Traditional methods need a significant amount of time and money, which often put a smile makeover out of the reach of many of our patients who would benefit the most.
That is when we had our eureka moment, a novel way to create a beautiful smile makeover in minutes. Welcome to Smilefast.
Smilefast is the sensational new concept that brings together the three essential facets of modern cosmetic dentistry: orthodontics, ceramics, and composites, to help both dentists and patients alike. By informing and guiding the treatment planning, we are able to cut out a lot of the time-consuming workload for the dentist, which helps our patients quickly access the smile they've always dreamed of. But Tom, how does it work?
Well, Smilefast uses the latest 3D technology and our patented Smilefast system to simplify the process. All you have to do is take the photos, then we design the smile and propose a treatment plan. Plus, we provide all of the materials. This is all possible due to an ingenious stent that allows you to place a custom-designed composite veneers smile makeover for the front 6 teeth in just one application. The teeth are pre-separated, meaning the finishing time is drastically reduced and much easier. In fact, cases can be completed in less than an hour. Due to these reduced times, dentists are able to offer more cost-effective smile makeovers to all of their patients.
We hope you can see how Smilefast will revolutionise and streamline the way that cosmetic dentistry is carried out. Gone are the days where smile makeovers were only for the rich and famous. At Smilefast, we aim to make the perfect smile perfect for everyone. Affordable, fast, profitable, and enjoyable. Welcome to Smilefast.
The new approach to a new smile.
Okay, apologies there was a little bit of a slow delay because the image quality. But basically, I hope that summarised what we're really about and what we're trying to offer. So one concept, 3 solutions. So the solutions that we're able to offer are orthodontics, then obviously ceramic restorations, which again, once the teeth are in the right place, ceramics is definitely a viable option. And then finally composite. And it's mainly composite that we're going to talk about today. So we've really thought this through. We've gone through a workflow for the average and the normal dentist, just like us. How do we see teeth? What is our end goal? So this is the workflow that we've come up with. Smilefast is about the design. So many of you here will be competent at seeing the end result, but there's some dentists out there that won't be really sure where to start. We'll be able to help you design it. Once it's designed, we'll be able to refine that smile. How? We're going to be able to do something called a trial smile. So the smile design that you've created digitally will be transferred to your patient's mouth for them to see and for them to approve, which is important for consent. Then align. Ideally, I think we all agree that it's best to put your teeth in the right position first before you plan to restore them. However, that's not applicable for all patients. So you can either go directly to the direct stage, or you can go to the indirect and restore the teeth that way. So the Smilefast concept. Again, I'm not going to read it all out to you, but really it was developed for every dentist to make the solution as simple as possible, to reduce the clinical time required for each case. That for me was the biggest single factor. At the end of the day, I love what I do, but it has to work as a business, otherwise it's not sustainable. Using digital technology and techniques, this has really made this possible. And finally, of course, when we're delivering this, we want to be able to teach dentists how to be able to do it. And as part of that, we provide everything required when you come on the courses. Okay, so the truth of it is, why is there a need for this? There is a huge population of patients who want a nicer smile already. Okay, so as I said, the majority of my patients, once I've aligned the teeth, they do want some enhancement. So it's not something that you necessarily have to go out and market to. These are your own patients, people that you're treating day in, day out. There are some barriers that people think about smile makeovers. It's notoriously and historically seen as something that's expensive. It's a high-skill procedure. Composite bonding is not easy. It's something that is technique sensitive and takes time for you to develop. And also the fact that the time-consuming nature means that for some types of practices, they can't even offer this kind of work because it just wouldn't fit into their workflow. And then finally, a lot of people view smile makeovers as majorly destructive to teeth. So, what's now? Well, general dentistry is definitely changing. Digital dentistry and adhesive dentistry together are allowing and actually pushing this change. So, as I said, composite bonding either alone or as part of the restorative cycle following things like alignment is certainly going to be the mainstay of aesthetic dentistry for many years to come. And I think, again, if we don't look too far on social media, we'll realise that cosmetic and composite bonding is really the fastest growing treatment modality in UK dentistry at the moment. And again, just to summarise the problem, it isn't as easy as it looks. The high skill level and the time. Smile design for people is often a barrier. They don't even know where to start, so again, that's an issue. And finally, in summary, stressful work. I had cases that caused me stress. I wouldn't sleep at night. And that's not what you want. Work should be enjoyable. And if you don't enjoy it, then you often won't even offer the solution. So that's when we invented Smilefast Direct. Smilefast Direct is a new solution to allow you to provide direct composite smile makeovers. You can now place up to 6 composites using a separated stent system. So you'll be able to achieve 6 separated composite veneers in just one application. It's going to be digitally designed and it's customized to your patient. It's going to be provided in the composite shade of your choice. And most importantly, the finishing required is going to be minimal. And we believe that this is the fastest and easiest way to place a direct smile makeover. Now we're going to tell you how.
So this is the exciting part, because as Minnie said, Smilefast is 3 solutions, is one concept. One concept is the Smilefast. It's an umbrella. Alignment, ceramics and composites, all 3 play a part in smile makeovers. You can't just have one, so we don't just teach one. Today, we're talking about the Smilefast Direct because this is the revolution of smile makeovers. This is the patented new process to place direct smile makeovers. This is the thing everyone's getting really, really excited about. However, Smilefast as a concept also covers alignment and it also covers ceramics. So being a Smilefast dentist, you follow the pathway, the patient chooses the option that's most appropriate for them, and we're there to support you the whole way, and we can give you the things that you need to achieve the end results. But today, we're talking about this, which is our patented pre-separated stent. So this is digitally designed. We take pictures of patients, impressions of the patients, we digitally design the smile makeover. We send the patient an augmented smile photo so they get to see what they're going to look like first. That gets their juices flowing, okay? We send them some treatment options, we give them alignment options, ceramic options, and composite options, and then the support for the patient is all on the website. So as a dentist, you can say to the patient, there's 3 options which will achieve your desired result. Go onto the Smilefast website, here are some leaflets that Smilefast have provided with all these different options. So the patient can feel really, really involved in the consent process, and they can choose the option that's most appropriate for them. If they choose the Smilefast Direct option, which is the composite option, we'll then do a smile trial. And a smile trial is a 3D printed model of their final result with a putty stent over it. We send that through to the dentist, fills it with acrylic, puts it over the patient's teeth, and it transfers an instant smile makeover so the patient can see what they look like. Really, really important for the consent process. We suggest taking a video of the patient, getting them to smile, getting them to talk. It's for everybody. It's for the patient to see how good it's going to look. It's also for the dentist to assess, to make sure the aesthetics are where we want them and everything looks balanced and it's not affecting speech, things like that. Okay? The dentist is happy, the patient's happy, everybody's ready to go. So then they go through to the stent. And this is made pre-separated and it's sent. It's an exact replica of that digital trial smile, so we know that it's going to look absolutely perfect on the patient. The difference between what we're doing and what everybody else is doing is we're using traditional paste composite. not flowable composite. Flowable composite has not got mechanical or aesthetic properties to be a permanent solution. So every other stent-based system is still using flowable composite, and they're still doing the every other tooth technique, which is time consuming, and every single patient has to sign a consent form saying that it's an intermediary solution to test the smile or to prepare them for a ceramic smile makeover. Smilefast Direct is a permanent solution using paste composite. By heating paste composite, we increase the flowability of it, which allows it to be used in our stent. Our stent is rigid, so it doesn't flex like a traditional silicone stent, so you can use paste composite and you can transfer a smile design exactly onto the patient's teeth in your chosen colour of Ivoclar Empress Direct. So it's top of the range composite, and this stuff polishes like you don't even know. It's ridiculous. You just run a polishing wheel over it and the luster is just incredible. It's such a phenomenal material. So that's what we're using. This is a stent in the mouth, 6 teeth, excess comes through the evacuation vents, dental assistant cures it, remove it, all you have to do is finish the margins and give it a polish, and that's it. It's an instant transfer. This takes an hour. I tend to book an hour and a half because I like to have a little bit of preamble with the patient first and a little bit of preamble with the patient afterwards. I take lots of photos and I take a video as well. So I book a little bit longer, but most cases are completed in an hour. So what can it do? What can Smilefast Direct do? It's a stent and it transfers composite onto teeth. So it can do pretty much everything, okay? But I think the indications where we really see it just saving so much time for dentists is tooth wear. So this is a classic tooth wear case. We see it all the time. Tooth wear is one of the biggest problems in UK dentistry. We are all stressed people. You know, we all grind. We have an abrasive diet. Smilefast wants to take the stress out of our lives. So hopefully none of you guys will have tooth wear because of your Smilefast. But this is a before and this is an after. So there we go. So that's rebuilding all the teeth in one hit, and that's the end result. Acid erosion is another big problem. People who drink Diet Coke, people who have a lot of fruit juice, there's a lot of vegans now who are having a lot more vegetables and raw fruit and stuff like that, and it's just stripping the enamel off the teeth, and we're seeing more and more and more of it. We've also got the people to worry about, like the bulimics and people like that, people with undiagnosed gastric reflux, you know, people on omeprazole, things like that. So acid erosion is a big thing, and Smilefast is an instant fix. Again, this is the after. So that was just, I only did this week, literally Monday. So that's why the gums are a little bit sore, because we retract the gums with PTFE tape. When you pull the PTFE tape out, you get a little bit of bleeding. So that's what the gums look like do. And this was done this week, and that's on a dentist as well. So we're very, very fortunate that people are coming to see us to have it done. Veneers. Okay, veneers, it's classic. You get younger patients wanting to have these Instagram smiles, okay? Now, as a dentist, it's all very easy to go, yeah, I'll put veneers on your teeth, yeah, I'll take 10 grand off you. It's not ethical, okay? You've got to think about these people and the position they're in and where they're going to be in 15 years' time. Will they be able to afford to have these veneers replaced? You have to prep for most veneers. Smilefast offers an alternative solution. No prep, composite veneers. It gives the patient what they want, but it's much more ethical, and for a certain market, the stent can be used for that. So this is a veneer makeover. Okay. Right. Incisor ledges. This is a kind of a classic case. These are the kind of the cases that come to see me all the time. They need a little bit of alignment, they need a little bit of incisor ledge bonding, a bit of asymmetry, perhaps one tooth is slightly darker than the others. Smilefast ticks all the boxes and it can fix this in one hit. There we go. Sorted. Okay. Now, crowding. Oh, we forgot about this one. Okay, so again, older patients tend to kind of have missed the orthodontics when they were younger. So they come to see us now and they say, you know, my daughter's got straight teeth, my granddaughter's got straight teeth, what about mine? I'm 70 years old. And I say, not a problem at all, we can straighten your teeth. It's going to take 6 months, we're going to use Smilefast Align, and I show them the options, and they say, I like it, but I don't really want it. I'm 70 years old, I don't want to wear braces, is there another option? Previously, the only other option was, we'll prep your teeth down and we'll put ceramic veneers on it. Now Smilefast can achieve straight teeth with zero prep. And that's it. Okay. And all of these cases were all completed from an hour to 90 minutes. I think 2 of them were 90-minute appointments and 3 of them were an hour appointment. 6 teeth, we're suggesting the price point is about £2,000 to £2,500. Depends on your area, okay? When I was an NHS dentist working in a very, very low income area in Essex, I just started to dabble in cosmetic dentistry. I found that the cut-off point was £2,000. You get the NHS patients who do have a little bit of money and they're prepared to spend a certain amount on their teeth. £2,000 was kind of the cap. And so when we designed Smilefast, we made sure that we were at that £2,000 mark. If you work in a private practice, then you can push it up to £2,500. The treatment time is half an hour for the refined stage. That's the trial smile. That's to show the patient what it's going to look like and to do the acrylic transfer, okay? The treatment time for the actual placement of the composite in this stent is an hour to an hour and a half. So let's call it an hour and a half, okay? And then the review visit a couple of weeks later, just to make sure everything's looking good, to make sure that they're happy with the aesthetics, etc., etc. A final polish that you might want to do, final photography, we say half an hour. Total time, 2 hours, okay? If you're charging £2,000, the lab cost is just under £600 for the whole thing. That's £700 an hour, which is more than I make on most of my high-end cosmetic work. It is so profitable, yet so accessible to so many patients. This huge market of patients that would never have been able to achieve a smile makeover because they simply couldn't afford ceramics. A whole group of dentists who didn't feel confident to offer smile makeovers in composite, so the patient didn't get anything. Whereas now we've brought two groups together. We've got the dentists who now have the confidence to predictably give a smile makeover, and we've got a price point that these patients can now afford. So it's going to be a massive practice grower. So this is the stent, that's the heater, it's all lab made. All you have to do is send photos and send impressions, we do the rest. This is David Bloom. David Bloom is past president of the British Academy of Cosmetic Dentistry. We did a trial lecture about 6 weeks ago, 2 months ago maybe. 2 months ago. We wanted to see, we selected some dentists from everyday NHS dentists, just doing kind of regular drill and fill dentistry, all the way through to high-end Harley Street cosmetic dentists with a lot of experience. We wanted to test every single group of dentists with Smilefast and get feedback, what worked for some, what worked didn't, where we could adapt it. So we did that, we had 15 dentists, and the feedback was beyond phenomenal. Every single dentist went home and said, we're going to integrate this into our practice. It doesn't matter what your experience level is. You can do something faster and more predictable, high-end, or drill and fill, it doesn't matter. If you can achieve a new market or you can make your existing market work more efficiently for you, it fits. So this is Dr. David Bloom just talking about Smilefast.
My name is David Bloom. I've been a dentist for 30 years this year. I'm a past president of the British Academy of Cosmetic Dentistry and I'm accredited by the BACD.
Sorry about the video quality, I don't know why it's so jumpy. These are all on our website, there's quite a few testimonial videos to have a look at.
I'm just curious how far we can go with direct bonding. It's difficult to do, and there's no doubt that Smilefast makes it considerably easier. I think other dentists may have a reservation because it's something new, but it's actually quite straightforward and makes the whole process of composite bonding much more affordable and simple. The composite veneers were excellent in shape and in texture and really minimal finishing to do afterwards. The process is relatively straightforward, low cost initially, involves just taking some photos and some impressions that will give an imaging. The imaging is then approved and converted to a digital 3D model with a stent allowing you to do a visual try-in, a trial smile, and if the patient approves, then you can continue with whitening and then go on to the bonding process a couple of weeks after they finish whitening. It bridges the gap between porcelain, which is probably still the ideal but a lot more costly, and allows a more affordable choice for those that don't want to pay for porcelain veneers, but it allows them to be done to a really high standard And composite bonding can be really difficult to do directly freehand, and this simplifies that process. Tom and Olumide are well-established dentists. I've known them both for 4 years plus. Tom is actually my dentist. They're both excellent clinicians. I've seen their work, and really high standard of clinical dentistry.
Just to confirm, we're not sold out. We've added more places to the dates. They were sold out, but we've added some more places.